The highly contagious COVID variant first found in the UK has now been detected in all 50 states. And the CDC says there are a total of 15,000 cases in the U.S. That number could be higher. Florida leads the way with close to 3,200 positive tests. Washington, by the way, ranks 18th with 223 known cases. And this comes as doctors say that children could increase the spread of that specific variant. And with more Washington students back in the classroom now, the big question is, what do we do now? So this morning, I'm joined by Dr. Scott Lindquist from our state's Department of Health. Good morning to you.
Good morning.
Okay, so what do we need to know about this strain of COVID we're talking about?
Well, when we're talking about the UK variant, we have a very robust surveillance program here in the state, and the UK variant is actually not the #1 variant in our state. What we have seen over the last couple of weeks is that the California variants are actually the largest majority of variants in our state in our surveillance program.
Okay, so how is this different from others when it comes to the impact it has on kids?
Well, the concern is that the UK variant may be a little more infectious to kids. We have not seen that really in Washington state. Like I say, we're one of the top states for doing genotyping of all our samples. And so we have not seen a huge impact on kids here in Washington state. I do know what my colleagues are saying around the country. I respect their opinions on this. I'm equally as concerned about how this is going to affect our kids, but the proof is in the pudding here in Washington. Let's continue to do our aggressive genotyping and see what strains are there and see how this impacts the kids. The other thing is we do a lot of outbreak investigations in the schools. We're really robust in knowing where there is an outbreak, when there's an outbreak, and how much of a problem this is for kids in schools. And it just has not been a huge issue here in Washington state yet.
Well,
we are looking for it.
Well, that's certainly good news. I mean, we have so many teachers, staff members that are very concerned about going back into school because of this exact issue. What do you say to them?
Yeah, I would really encourage them to vaccinate. We really need to get our teachers vaccinated. I know there was a big push to prioritize them, but now the issue is, if you're a teacher, don't decline the vaccination. It's really not about you. It's about vaccinating to protect the others around you and the kids in the classroom.
And the vaccines on the market do protect against this variant that we're talking about?
Indeed, they do. There's still good activity against the UK variant or the California variants that we're seeing here in Washington state. But one thing that does work, not a question about it, is wearing a mask, distancing, and washing your hands. So those are tried and true practices that the schools and any parents need to continue to recommend. Again, if a parent is eligible for a vaccine, then the parents, if they're eligible for a vaccine, should get vaccinated. And again, you know, the state is going to open up here in about a week and a half. So that would be really helpful for all the kids in the state.
You had your assistant messing with your camera, did you,
That
Dr.
was my cat.
Yeah,
that was my cat.
That will happen. Okay, so we see the kids going back to school, and we're also seeing sports ramping back up, which is great to see the kids out playing. Is that a possible spreader of these variants?
Yeah, you know, people have looked pretty closely at sports, and sports are not, especially the outside sports, are not big spreaders of the disease. I mean, there's always a possibility. So again, we would recommend the guidance of mask and distancing and not congregating at all possible. But sports that have been studied, especially things like cross country or track, outdoor sports, really have fairly low risk.
All right, so we've been talking all morning about, the spread of the virus, but also talking about increased traffic at SeaTac Airport, huge long lines trying to get through TSA, and also we're talking about 38,000 fans packing a stadium in Texas for the Texas Rangers yesterday. So state by state, the guidelines are very, very different, and the CDC talking about a possible fourth wave of COVID in the U.S. This has to be a concern for you as well, right?
Oh, absolutely. I have been saying since several weeks ago, we are going to expect a fourth wave here, and we're already seeing an uptick in cases here in Washington state. So on one hand, we do have the vaccines and people are improving the number of Washingtonians vaccinated. So that's helpful and that's going to moderate this fourth wave. But what's more important, again, is all these things that we know that work against variants and standard strains of COVID, the masking, the hand washing, and the social distancing. So I'm cautiously optimistic that if we follow all these principles, we really get many more people vaccinated over time, we may be able to blunt or lessen this fourth wave that's going to appear here in Washington State.
Definitely, and here's hoping. All right, Dr. Scott Lindquist with the State Department of Health, thank you for your time. We appreciate it.
You're welcome.